Hey everyone, and welcome back to the Code and Canvas podcast, episode 204.
Mark, I'm already excited, just saying the episode number. We're diving into something that feels like pure sci-fi coming to life.
Oh, it really does, Jenny. We're talking about computer vision in healthcare in the U.S. and the numbers. Well, they're quite something. I was just reading about this and...
Wait, what are these numbers you're hinting at? Spill it.
Okay, so basically what's happening is the market is projected to hit a sizable $11.53 billion by 2029. It was around $3.93 billion in 2024. That's a compound annual growth rate of 24%.
Wow. Okay, 24%? That's not just growth, that's like a medical imaging data flood on fast forward. What's fueling that kind of acceleration?
Exactly. You hit on one of the key drivers right there. The sheer volume of medical imaging data. Radiology departments are handling something like over 100 terabytes of imaging data * a month now. Humans just can't process that efficiently anymore.
Right, you need some automated assistance to even sift through that, so it's the data volume. What else gives it that push?
Another big one is the regulatory environment. The FDA is actually playing a positive role here. They released draft guidance on AI-enabled medical devices, and it's helping clarify the path for these products to get approved. It's making things move faster, apparently shortening approval times by around 30% for some devices, provided they're doing post-market surveillance.
Okay, that makes sense. Regulations are crucial, especially in healthcare. Knowing there are guidelines for how these AI systems are developed and monitored, that builds a degree of trust.
Precisely. And it's needed because of where computer vision is being used. We're seeing major applications in diagnostic imaging. That's like 48% of the market right now. But also patient monitoring and even predictive maintenance for hospital equipment.
Predictive maintenance with computer vision? That's not something I immediately connect. How does that work?
Oh man, this is the interesting part. Think about expensive medical equipment, an MRI machine for instance. Downtime is incredibly costly. Predictive maintenance uses AI, often linked with IoT sensors and computer vision, to spot early signs of wear and tear. It's like the system looking at itself and saying, hey, I might have a problem soon, before it actually breaks down. I was just reading, it can save hospitals hundreds of thousands of dollars per incident by preventing surgical delays and optimizing maintenance schedules.
Wow, preventing downtime on crucial equipment. That's a smart application I hadn't considered. It moves beyond just diagnostics into operational efficiency.
Exactly. And speaking of patient monitoring, there's a good case study with Caregility Corporation and their IOB server solution. It's being used at places like Johns Hopkins and Mayo Clinic for fall prevention.
Fall prevention? Using computer vision?
Yeah. It uses algorithms to monitor patients discreetly, recognizing movements that might indicate a fall risk. Apparently, they significantly reduced false positives, which means fewer unnecessary alerts for nurses. Cutting down on that alert fatigue is a considerable benefit.
That's a tangible benefit. Improving patient safety and making the nurses' jobs more manageable. This isn't just about interesting tech. It's about making real improvements in healthcare delivery.
Absolutely. Now, while all this sounds promising, there are of course challenges. Algorithm accuracy is a big one, making sure these systems are highly reliable across diverse patient populations.
Right, you can't have a system that only works well for one specific demographic. Bias in the data or the algorithm itself would be a serious problem.
Precisely, and that's part of the FDA's focus as well, ensuring bias mitigation. Data security is another crucial one. Dealing with sensitive patient data requires considerably robust systems, which is why PC-based systems are still dominant in the U.S. right now, because they can often offer better control and meet HIPAA compliance needs.
Okay, that makes sense. Keeping that sensitive data localized. So even with the cloud advancements, on-premise still has a significant role to play in healthcare for security and regulatory reasons.
Here's the thing about PC-based systems. They integrate well with existing hospital IT infrastructure, which can be quite complex. It's kind of like fitting a new piece into a well-established, intricate puzzle.
Got it. And what about things like the cost and complexity of implementing this hardware? Is that a barrier?
It can be. The return on investment for hardware in healthcare settings can have a longer time frame, sometimes over 7 years for amortization. That can affect smaller healthcare providers and their ability to invest.
Yeah, that makes sense. It's a considerable upfront commitment.
So we've got the technical
hurdles, the ethical considerations around bias and data. What about the human side? Are clinicians readily adopting this tech?
That's a good point. Clinician trust and seamless workflow integration are essential. You can have the most accurate algorithm in the world, but if it doesn't fit into a doctor's existing process, or if they don't trust it, adoption will be slower. Training is crucial.
It's not just dropping the tech in, it's about changing practices and ensuring everyone feels confident using it. This is fascinating, Mark. It feels like we're just at the beginning of seeing how computer vision could reshape healthcare.
Definitely. And looking ahead, I think we'll see even more expansion into telemedicine and home healthcare, pushing the capabilities of edge computing for real-time analysis outside of the hospital. Plus, continued focus on interoperability so these systems can talk to each other across different platforms.
That interoperability sounds crucial for a truly connected healthcare system. So, strong growth, interesting applications, and some significant challenges to navigate. But the momentum seems rather clear.
The momentum is definitely there. It's a dynamic space, and we'll keep an eye on it. This has been a really insightful dive, Jenny.
Agreed. Thanks for breaking down those technical concepts and painting such a clear picture. And thanks to our listeners for joining us on this episode of Code and Canvas.
Absolutely. We'll catch you next time.